To continue with the morning session, another important stakeholder we know beyond the policymakers, the industry. So we would have one interesting industry session, and this is one pharma company who have been working with pharma products, drug discovery, and digital marketing of generic pharma products. This session is called Digital Panacea for Effective Health Management. And to make the presentation, I would like to invite Dr. Alben Sigamani, Chief Scientific Officer of Numen Health. Welcome, Dr. Sigamani.
Good morning, and thank you for this opportunity, APAC, for inviting us to this session. Over the next 10-15 minutes, I'd like to just walk you through how we feel that digital health is actually going to transform healthcare management in India. And I think over the morning sessions in the inauguration, we were kind of informed about what the government efforts are, what the public body is trying to do. And I think India is in its right stage at this point in time to leapfrog itself from where it's standing as far as its healthcare is concerned into a completely digitized healthcare platform. So I'll kind of walk you through some of the current opportunities or challenges, I would say, challenges converted into opportunities itself. So we have the 5 A's that kind of are currently affecting healthcare. And I guess these also become the opportunities where digital technology or technology per se is going to really support. And the 5 A's stand as awareness, which is a big thing as far as health literacy is concerned. People should be able to know how health is affecting them, what needs to be done about their health. There's access to healthcare, which is another important element which changes outcomes in them. Then there is this absence or the differentiation in the healthcare providers and healthcare workers and the public who require the healthcare services. And there's a big cost factor about affordability that comes in, and lastly, accountability. And I guess these are the 5 A's which kind of are currently seen as challenges, but I feel that they are actually opportunities. And I'd like to kind of go through these 5 A's. So WHO defines health awareness as a cognitive and a social skill, and it basically has 3 components. It needs to improve knowledge, skills to process the knowledge, and manage their health. So a person who says he's health literate is someone who has the knowledge about what's going on in him and then has some skills to be able to process that particular knowledge. Let's say, for example, you give him a blood investigation report. At least he should be able to know what is wrong, what is not, what is normal, what is abnormal in him. So that level of processing is important, and then from that point onwards, they also should know how to manage their health. This is what is termed as health literacy, and across Europe, in the US, everywhere, there's a big push to improve health literacy, and I think technology or digital technology can play a major role in this particular element because it is able to transport information at the click of a button, and people are now accessing all of their information that they need on their mobile phones. Coming to access, we have been ranked pretty low in our ability to provide health access to all our population. We've made some changes, but there is still inequitable distribution of this particular change if you go by the state to state wise of what is called as an HAQ index. This is a paper which is published in the Lancet, and in Lancet kind of was trying to show that across the world that there is a difference in the healthcare access and quality index, and India was kind of showing an improvement, but it's being brought down by the fact that we do have inequity in the way this is distributed. And a large component of this is because there is concentrations of health access in certain areas, and there's complete lack of health access in many areas. And I guess this is where, when COVID happened and when we started adopting digital health as a mode to go forward from telemedicine platforms and other aspects, we were able to kind of break through these kind of barriers to go and reach out to the most remotest place. You could have doctors sitting in a city in Delhi or Bangalore and accessing people who are sitting in very remote villages in Bihar or other parts of the country. Then the question about absence of healthcare, or healthcare workers. We talk about the doctor to patient ratio, and according to a 2011 study, we were shown that we do have healthcare workforce, but it's kind of distributed. It's distributed across different types of healthcare delivery. We have the allopathic doctors, you have the Ayush doctors, you have the nurses, you have the pharmacists. But as a whole, in 2018, there was a report that came out which showed that we seem to have hit that little golden finishing line as per the WHO. We seem to be hitting a 1:1,000 mark of having one healthcare worker for 1,000 population. But that's again, the distribution of it is sitting largely with regards to how the distribution of doctors, which is the allopathic doctors to Ayush doctors. Now, how do we integrate these two systems of medicines, or how do we make these systems to work together so that more access of healthcare can happen and improved quality can happen? Again, I think the digital health is where that platform is really going to make a difference on that. Coming to healthcare expenditure. Now, we all talk about affordability. We talk about, is there sufficient money being spent on healthcare? This is from a recent report that came out from the government of India, which showed that Indians are spending almost 3.84% of the total GDP in healthcare, which is not bad compared to some of the developing countries. We are not as big as 16%, which is actually considered abnormal as far as the US is concerned. But the biggest challenge that we face here is that 70% of this particular spending is happening at the personal household level, where they do it out of pocket. Now, this component is actually affecting the outcomes of these patients, because largely these patients end up spending that kind of money in a catastrophic manner. They do it in the last stages. And if you look at this particular graph, it basically tries to show that we're investing a very low amount in, sorry about that. We're investing a very small amount in primary health care, or we're trying to, from preventive cares, the amount of investment or expenditure that is happening is at a very low thing. So we are having people coming into hospitals at a very late stage of their disease, and they're spending large amounts of money, but they're having poor outcomes. So again, that's where, from an expenditure of affordability perspective, there is a component of mismanagement, I would say, from there, which we can create an opportunity which can also be taken up by a digital health platform. Now, coming to accountability, we define accountability from the perspective of a physician-patient shared facilitated decision making, where doctor and the patient is sitting together and deciding what treatment they need to take. Or it could be an accountability where the consumer, which is the patient, has the choice of who is supposed to provide health care to them. Or you can also have a multidisciplinary team, like you have the multidisciplinary team looking at oncology, managing a patient with cancer. Now, that's where accountability comes in. From this perspective, managing expectations through appropriate communication becomes very important, because sometimes the expectations can be so varied that would not really, we will not be able to meet those kind of expectations. And here again, governance and regulations of pricing becomes into picture. Now here, again, is an opportunity which I would say that digital health is able to contribute in a big way, because we are able to kind of bring in different quality systems. We are able to bring in different evidence-based systems into delivery of care, and this is how we can actually address these 5 points. Now, I represent a company, a startup called Numen Health, and we've been in this journey for almost a year now, and our objective has been to deliver healthcare which is physician-driven. So we want the doctor to be in the center, and using the doctor, we use a multidisciplinary team to deliver evidence-based healthcare to them. And our objective is to see how we can prevent catastrophic spending that happens in the end. And we are aimed at spreading health awareness. We are bringing in all our subscribers, keep getting information on their phones about their health status. It's personalized to them. It's not generic information that's being given. It's personalized information that's given to them. We're making healthcare more accessible to these patients because now they become closer to the doctors through a multidisciplinary team. And also we make it affordable because ultimately when you prevent a hospitalization which is not necessary, you prevent a complication which can be actually averted early, you are actually saving a lot of money for the patient because it's just if he just continues, a very common example given is a heart failure patient, if he measures his weight every day, checks his BP regularly, can avoid a hospitalization because he just needs to take his diuretics correctly, which is a very cheap drug for him to take. So that way, if you're looking at it, we are able to even bring down the cost through prevention, and we're making it very convenient because people like to have the access to their doctors through their phones, and we're trying to make that very convenient. So that's what we are doing from Numen Health, and I'm really happy to be on this particular event. And I congratulate APAC for bringing together such stakeholders to discuss about an important topic about digital health and how that is going to transform healthcare in India. Thank you, folks.
Thank you, Dr. Sigamani. That was really inspiring